Hello, I'm Arun Krishna, one of the consultant colorectal surgeon, work at South Tyneside and Sunderland NHS Foundation Trust. What are the options involved in bowel cancer treatment? Surgery to remove the cancer is the most common treatment for colon and rectal cancers. Other options considered are chemotherapy, radiotherapy, placement of stent across a blocked bowel. Let us look into the surgical options in detail. The type of surgery will depend upon the size and site of the cancer in your bowel. Option 1. If you are diagnosed with very early stage of cancer, sometimes we remove it using through colonoscopy from the lining of your bowel wall. This means we do not need to make a cut in your tummy. This technique what we call local resection or endoscopic resection. Option 2. Removing part or all of the colon is called resection or colectomy. How much colon is removed is depend on its size and where the cancer is situated. Usually the lymph nodes near the colon are also removed and tested. This is because cancer cells can spread to nearby lymph nodes. After the part of the bowel has been removed, the two open ends of the bowel are joined together, or one end may need to be brought out to the surface of the tummy, what we call as a stoma. I know in the hospital we use a lot of medical terminology. Let me explain about bowel resection and other terms commonly we use. Total colectomy. It means removing the whole colon. Hemicholectomy means removing half of the colon. If you are diagnosed with the bowel cancer, in the right side of the colon, we carry out an operation called right hemicholectomy. What it means, removing right half of the colon, which is ascending colon, and right half of the transverse colon, then joining the small bowel to the remaining colon as described in the picture. If you are diagnosed with bowel cancer on the left half of the colon, we remove the left of the colon, what it's called as left hemicolectomy. If you are diagnosed with the bowel cancer in the middle of the colon, what we call transverse colon, then we'll remove that portion, that is called transverse colectomy. Sometimes you are diagnosed with the bowel cancer in the part what we call sigmoid colon. We remove that portion, that is called sigmoid colectomy or high anterior resection. Let's focus about the rectal cancer. If you are diagnosed with the rectal cancer, the rectum links the colon into your anal canal. It's about 15 centimeter long. We divide the rectum to plan the treatment as an upper, middle and lower part. If your cancer is situated in the upper or middle part of the rectum, it can be removed by an operation called an anterior resection. We remove the part of the rectum that contains the cancer, then rejoin the two open ends of the rectum. You may need to have a temporary stoma after this operation, what we call ileostomy. What it means, bringing the small bowel to the surface on the right side of your tummy. Usually we aim to reverse this stoma few months later once all your treatment is completed. If the cancer is very close to the anus, you may need an operation called abdominal perineal resection. This is when we need to remove the rectum and anus completely to remove all of the cancer. You will have a permanent stoma after this operation. You will have a wound on your bottom where the anus has been closed, and it gradually will heal in few weeks' time. If the rectal cancer has grown into other organs nearby, you may need a bigger operation to try to remove it. This involves removing nearby organs as well. This is called a pelvic excenteration. It will require further detailed assessment and discussion at our regional center. You will be referred to our regional center, Newcastle. So far you heard about the names of the operation. Now I will explain about the techniques we use. We use three types of technique, what we call open procedure, second one called keyhole operation or laparoscopic operation, and the third option is robotic assisted laparoscopic operation. What is an open operation? Surgeon makes one large cut in the tummy and carries out the planned operation. Keyhole operation, what it means, we make 3 or 4 small keyhole through the tummy and carry out the planned operation. In the robotic assisted procedure, we use robotic arms through the keyhole and carry out the planned operation. Your surgeon will discuss the options and advise the appropriate technique for you. Let us look at the treatment options if someone comes with a bowel obstruction. Depends upon the assessment of your condition and the site of the cancer, one may require an emergency operation to remove the blocked section of the bowel. Most people will have a temporary or permanent stoma after this operation. Sometimes we may use a colonoscope to insert an expandable metal tube, what we call as a stent, into the blocked bowel under the X-ray control. Then the tube expands to hold the bowel open so stools can pass through it again. This is an emergency procedure to relieve the obstruction. You may have a stent for a short time before having an operation to remove the cancer, or sometimes a stent stays in the permanently to treat the blockage. We'll explain what is the aim of the stent in your situation. We talked about surgical option. Let us focus on chemotherapy. In some situations, you will receive chemotherapy before surgery. What we call this as a neoadjuvant chemotherapy. Or you may receive chemotherapy after surgery to reduce the risk of cancer coming back. In this situation, we call it as adjuvant chemotherapy. Bowel cancer sometimes spreads to other parts of the body, such as liver or lungs. This is called secondary cancer or advanced cancer or metastasis. In this situation, chemotherapy may be the main treatment. It's given to shrink the cancer and to control it for as long as possible. Some people with secondary cancer have chemotherapy to shrink the cancer before having an operation to remove it. Chemotherapy may also be used to relieve symptoms if the cancer has come back after treatment. This is called palliative chemotherapy. So far we looked at surgical options and chemotherapy. Now let us focus on radiotherapy. What are all the situations we offer radiotherapy? Radiotherapy is used as a part of a treatment plan, particularly if you are diagnosed with a rectal cancer for a selected patients only. Radiotherapy is sometimes given before operation or sometimes after an operation. If we decide to offer radiotherapy before the operation, the aim is to shrink the cancer so that it is easier to remove at the time of operation and to reduce the risk of cancer coming back. You may have a short course of radiotherapy which is given once a day for 5 days the week before the operation. You may be advised to have a long course radiotherapy which lasts up to 6 weeks and is usually given along with chemotherapy, what we call chemoradiotherapy. After the long course, it's usual to wait for 6 weeks before arranging an operation. We will also repeat your CT scan and MRI to assess the response from your radiotherapy treatment. This will guide the surgeons to plan their operation. As I mentioned earlier, sometimes we offer radiotherapy after surgery. What are the situations? If radiotherapy was not given before your operation and we find out from the lab result, cancer cells are found on the edge of a healthy tissue, then some situation we might recommend radiotherapy after your operation. The third situation where we offer radiotherapy is sometimes we use it to relieve the symptoms such as a pain or bleeding. This is called palliative radiotherapy. So far we looked about the options of treatment. In case if you require an operation, you may want to know more about the preoperative preparation, what happens in the hospital at the time of your operation, how will you recover from the operation, what will be your pain management, and what will be a plan for your discharge. Please read our Enhanced Recovery Program leaflet, which gives detailed information related to these questions. Many thanks for watching this video. I hope I have given enough information, and please feel free to contact our clinical nurse specialist or my secretary if you need more information.